there, superstar. How are you? Fantastic. Are we ready to go to Sainsbury's? Go on then, well done. And we'll wait for the cars. Great job, Tia, well done. Would Tia like to make some nice cards after lunch?
Birthday card.
Does that sound like fun?
I think so, yes.
Brilliant. Okay, well I'll see you after lunch for some nice card making.
TL is absolutely gorgeous, I have to say. Everybody who works with him says how wonderful he is. His autism varies from day to day, so it depends how stressed he is. So you have to be able to read him, really. Never ever, when he was first diagnosed, did I think we'd be able to say he was happy in his own home with a degree of independence, and he's got a life of his own. But it has been one long battle.
I had a rare form of liver cancer. Life as a transplantee is completely different. I fought against it for a long time to be defined by it, but my entire life is about it. Getting care, it could be quite challenging. My care has now been outsourced to an agency. While most of the times it's okay, not knowing when somebody's going to come, if they're going to come, you physically, mentally prepared for it, then it doesn't happen. It's like this big deflation. It's not a pleasant position to be in, not being well. It's not a pleasant position being in to be dependent on other people. Regardless of what is happening with you currently, you're still a human being. When training is going on, or when talking about how to meet the needs for people that require care, dignity is very important.
I had to grow up so quickly. I mean, it still felt like I'd lost my childhood almost. It was a bit daunting because I'd never been called a young carer. It was just part of my life. With kind of this subsection, because we have to act like adults, but we treat like children. Started coming to young carers when I was 12, 13, and then I joined the action group, and it gave me a voice to actually speak for myself. There's always been issues with them sharing stuff with me. Doctors don't ask me questions either. No one explained to me, you know, what ME was. So when my mum shut herself away and stayed in a room and wouldn't come out, I felt awful, thinking I'd done something, when in reality it's that she just didn't have the energy to. And only recently, now above 16 and I'm legally next of kin, has the information ever been shared with me. I've only been asked kind of how I'm dealing with caring for my parents in the last few months, and for half my life I've been looking after them. But it felt brilliant when I was asked. It felt like someone was actually looking out for me, and they were asking me, you know, how's it affecting mental health? And I'm like, well, you're actually asking, so that's going to go on my file so the doctor knows. And it means that then when I need medical help, they have something to better inform my care out of. If I'd been given the amount of support that I know is possible, it would have meant I wouldn't have struggled as much. You know, I would have probably been able to stay in school more, means I would have got better GCSEs. It's even just something that's ringing and asking how I am might have made that difference. Maybe they could have picked up on conditions earlier, both for me and my mum and my dad. And that meant that they can get treatment sooner and maybe might not have progressed as much.
Almost wears you to break down to fight at all these stages in someone's life.
If you haven't got strength as a couple, if you haven't got some knowledge, if you don't push as a family member, then it's really difficult to get what they need. I've lost count of the number of times that we have gone through TL's history. Autism doesn't go away, and he's always going to need 24/7 support because he's not safe. He'd open the door to anyone. He can't go out in the community by himself, but you have to keep saying this over and over again.
The departments that you have to deal with don't talk to each other. There's no overall view.
Trying to balance things in any everyday life is difficult. Your care needs might change within a week or within a day. We might have this plan for today. We might have a plan for shopping today, but it does not mean that I can get down the stairs. And so trying to navigate that and having people who understand that is sometimes very challenging.
My view would be that you'd have the circle of friends and support workers together in a meeting with the people who are making decisions to have a proper discussion about what the strengths and problems of the person was, what would and what would not work.
We find out if anything has improved rather than having to go back to the beginning and go through it all again.
And you would like the system to think, this is a genuine person of value. Don't think, first of all, this is a person who's going to cost money.
We need to get together and to make sure that what is happening is right for them. I mean, you often hear it said that if you get it right for the person with autism, you've got it right for the rest of society. We haven't got there yet, but if we can, then that would be fantastic.
A better system for young carers would mean more integration, more things passed on between different services, so we're not having to do the running about. It wouldn't be this checkbox and that kind of dehumanisation. It'd be personalised to you, and it would be, how does it affect you? One process, one system, it would mean that people could keep better tracks of conditions so we wouldn't have to, and it would mean that our status as carers would be known to more than just one organisation. It means that I'd get so much more support because they'd all be aware of it and they'd all be including me. It would mean information is not only passed on but is able to be discussed, and it would take the load off young carers and unpaid carers.
The staff have been absolutely amazing with TL during lockdown. They've got him to do all sorts of things.
They are very prepared to alter their behaviour to make themselves work effectively with that person, and that is so important. It puts your mind at rest.
My ambition would be for everybody to be able to get through the system without the parents having a battle, with it being there for them, with the council to say, let's lead you through this process, with the health authority to say, let's lead you through this process. We're going to get the best we can possibly get for you and your son or daughter.
Your culture becomes even more important when you get sick. So that is something that needs to be recognised. A liver transplantee, I've only been that for nearly 9 years. My culture, I've had it for 47. When they're not well, people want that to be acknowledged even more. Yeah, because it is who you are as part of your identity. If the system was smooth and it flowed, it would be far less anxiety, far less stress. When things get bad, I go and see my family or I talk to them. Yeah, that kind of centers me and get me back to me